Hi Maddy, how you going? David Johnson here, everybody. Maddy, it's flattering that you've asked me to participate in your new blog column on one of your social media outlets, so that's fantastic, and I think it'll be really interesting for people to read. So you've sent me a heap of questions here, Maddy, so I'll just try to go through them, and hopefully this format of answering your questions is reasonably watchable for people. I'm flattered that you asked me to participate too, by the way, so it's not every day that people want to know much about what I do, unless they've got major neurosurgical problems or something of that nature. But to be asked by yourself for your blog, that's really cool. So your first question is, give us a little bit of background information about you. So, well, I'm 45 years old, married, you know Joanne, my wife, and 2 kids, 16, Charlotte, grade 11, crazy times, and Harry, 13. So he's in grade 8, and that's number one for me, I suppose, is family, and then work comes after that. But we're all pretty passionate about our work in our household. I'm lucky enough to be working with Joe at our practice, City to Coast Neurosurgery, and the Functional Movement Training Centre, integrated with the Back Pain Centre Clinical of Excellence at St Andrew's Hospital, which is in Spring Hill, Brisbane. So my training is in surgery, and I'm a neurosurgeon, which means that I operate on the brain and spinal cord, and also mechanical elements of the spine as well. So we sort of do a lot of spinal surgery similar to orthopedic surgeons, but our training is slightly different because we also go beyond the bony spine into the spinal cord and nerve roots, which is a bit of a distinction between orthopedic spine surgeons, who really don't go beyond the bony integrity of the spine. But a lot of the surgery that orthopedic spine surgeons perform is very similar to the surgery that spinal neurosurgeons perform. So my qualifications are Bachelor of Medicine, Bachelor of Surgery, Fellowship of the Royal Australian College of Surgeons, specialising in neurosurgery. When did all this start? My medical career pretty much started after high school. So I graduated high school in 1990, started med school, which in those days at University of Queensland, St Lucia campus and the Hurston campus, went for about 6 years, a 6-year course. And then we did an internship, and then a principal house officer role, and then a streaming into a specialty of medicine. So you could have become a GP, or you could have been a general practitioner and gone out and started your own practice in the suburbs, or you could say, I want to do some sort of specialty, and then you start your what they call fellowship training. And I chose neurosurgery, and that took another I did a couple of years of non-specialised training, just general surgical skills, like general surgery and orthopaedic surgery, urology. Did that for a few years, and then realised that I wanted to do neurosurgery, and then that took another 6 years on top of that. And then I worked at the Royal Brisbane Hospital as a consultant for a few years, and then I started up my private practice, which is now City Coast Neurosurgery. What's my philosophy and approach to healthcare? Well, currently, I think as a general rule, we're not doing very well to optimise the health of the community. I think medicine's got a little bit lost in terms of what the values are, particularly in relation to preventative healthcare. And I think if we changed our tact a little bit and started focusing much more on preventing disease, we get a lot more bang for our buck. And I think that's where a lot of my attention has been directed towards now, is trying to educate people about how to prevent the onset of disease, and particularly the epidemics of diabetes, obesity and musculoskeletal pain, which are really massive economic health burdens on our society. And we've really lost sight of that in favour of patching people up with really expensive, dangerous and temporising symptom-based approaches, and the paradigm. There really needs to be a paradigm shift towards prevention and cause-based medicine rather than symptom-based medicine. So another question: what does a typical day in your life look like? Well, number one, I don't get enough sleep, and so I would have gone to bed usually around. I'm very rarely in bed before midnight, and I'll be pretty tired in the morning. Get up at around 6. The alarm clock goes off. A couple of snoozes, and then a hot brekkie every morning. Thanks to Joey. 3 eggs every morning, and there's some meat. Make my own coffee, espresso. Elixir, the best bean for a fantastic coffee. I will always add in a bit of coconut oil to my coffee, and also kick off the day with a swig of Nordic natural fish oil. Okay, just doesn't feel right if I don't have that. It's just a habit. I need that, and it's a natural anti-inflammatory. All those omega-3 oils, which we just don't consume enough of with our modern diets. Even though I'm actively seeking super healthy food every day, we just don't eat enough fatty fish and flax seeds to get enough omega-3 oils, and we really want to offset the omega-6s that are ubiquitous in our diet. So then it's usually Mondays and Fridays are surgery days, so kick off a little bit earlier, and then I'm just basically in the operating theatre all day Monday and Friday, operating on brain or spinal conditions. Tuesdays, Wednesdays, Thursdays, it's consulting all day. Okay, and most of that consulting is here at St Andrew's Hospital. I'll usually then tidy up admin, and then I always try to squeeze in a functional movement workout. So my functional movement training is either the training that we program here at the hospital, at the Functional Movement Training Centre, or in our NeuroFit classes, and I try to participate in those with my patients who are becoming athletic by engaging in functional movement. If not, I'll do a CrossFit workout, and at the moment following the Brandon Swan's Swan Strong program, and that makes it really easy, so I just don't have to think, just go and do what's programmed. And I love the variability that's associated with that. It's exciting to sort of know that there's going to be something different every day, and it's going to promote a strength domain and a skill domain and some high intensity, which just makes me feel fantastic. And no matter how much stress that I've had in my day, doing that 1 hour of functional movement training, hitting high intensity, you feel fantastic after that. And I think that gives me a lot of energy to then go back and hang out with the family at home, have dinner, and then get into a little bit more administration, or answer emails and work on some projects until the evening, and then by that time it's around midnight. Next question: what was your experience like speaking at the CrossFit Health Seminar in 2018? So, yep, I was asked to give a lecture at Madison, Wisconsin, at the CrossFit Games Health Conference, and I talked about our experience with helping to solve this most vexing problem of back pain, which is the leading cause of disability on the planet, or spine-related pain, in particular back pain. And it was an honour to be able to be up on that stage, talking about how we're approaching back pain, and by incorporating functional movement, which is really the main focus of the CrossFit methodology, functional movement at high intensity. By us incorporating functional movement training into in a clinical setting in patients, no matter how old or young, we're able to improve patients' skill acquisition, improve patients' biomechanics. And if we improve patients' biomechanics of movement, we reduce biological inflammation. And if we reduce biological inflammation, we start to mitigate structural breakdown, pain and disability. And so therefore it really flips the understanding of musculoskeletal pain on its head, really, to be a functional problem, not a structural problem. And currently, on a global scale, the spine pain and the back pain therapeutic industry is trying to manage back pain as if it's primarily a structural problem, and they're not conceptualizing that the first thing to go wrong is a functional problem. If we think about what the actual purpose of having a musculoskeletal system is, bones, muscles, ligaments, tendons, it's movement. And if it's a functional problem that's the first thing to go wrong, it has to be a movement-centric problem. So I refer to the first domino that falls over as movement dysfunction. Movement dysfunction is a disease that's not recognised in the textbooks. Movement dysfunction is the disease that drives musculoskeletal pain. And it just so happens that back pain is the leading pain symptom on the planet, and the leading cause of disability on the planet. So it was fantastic to be able to put that out there in the CrossFit circles, which was the primary audience at that conference, even though it was an international seminar, to be able to put that out there on the world stage, that movement therapy is very distinctive to all of the other therapies that are out there: physiotherapy, exercise therapy, core strengthening, Pilates, hydrotherapy, manual therapy. They're not hitting the discriminator on the head. The discriminator is, does this patient have skillful movement? And if we're going to fix that, we need to transfer skills to that patient, not just treat them like a redundant individual lying on a couch and apply stretching and manual therapy or strengthen their core. That's not going to work because it doesn't upskill them. What is your view on Greg Glassman's approach to healthcare? And more specifically, the sugar debate? Well, I think there's lots of things that compromise health, and sugar is one of them. I think the issue with the sugar is that sugar is like the sugar industry is a bit of a wolf in a disguise of is trying to promote health with a covert agenda to sell more sugar. And I think that's why Greg Glassman is so obsessed about tackling the sugar industry, because it is actually it is trying to weave its way into the health industry, but yet its agenda is pretty much to just sell more sugar. And that's why we see companies like McDonald's and Coca-Cola and all of the other cereal producers and things like that that primarily are selling glucose, dressing themselves up as a health product. And I think that's entirely wrong, and why CrossFit is targeting sugar. There's many things that they could target, drugs and smoking and alcohol, poor movement, but drugs such as alcohol and smoking are not going out there overtly trying to claim that they're a health product. We know and they know that they are not a health product. They're not trying to put out there to the community that they are a health product, whereas the sugar industry has a very different approach. They're trying to promote themselves as a bit of as something good for you, the goodness of whole grains and Uncle Toby's Just Right and all of these types of slogans that are trying to make out that sugar is, Milo having a 5-star food rating. There's something really corrupt, or a 4-star, 4.5-star food rating. There's something corrupt about the system if Milo can get a 4.5-star food rating, because it makes Milo look like it's a health product, when it's not. It's just sugar, and there's no conjecture as to the harmful effects of insulin resistance, which is driven by excessive consumption of glucose and fructose. All right, well, I've been carrying on a little bit long. I don't know whether you want any more. How is your rehabilitation program so successful? Well, we have talked about that. It is pretty successful. We manage patients who are really at the end of the line of their treatment. They have nowhere else to go. Nothing else has been successful for them. They come to me because the GPs are pulling their hair out. They don't know what to do. They've already seen the physiotherapist. They've done exercises. They've been to the pain specialist. They've been to rheumatologists. They've been to musculoskeletal pain physicians. They've had injections. They're on morphine. They've probably had surgery sometimes. They're thinking about having a second operation. The first one didn't work. These are the almost train wrecks of patients that come to see me. And my job as the surgeon is to work out, is there another structural deficit that needs to be fixed? 9 out of 10 times there isn't a structural deficit to be fixed. It's purely a functional deficit. And because we have a philosophy of correcting functional deficits being movement, and because we define what proficient movement is, that's what makes our program, or NeuroHab. That's what makes NeuroHab so successful, because we are specifically defining movement proficiency for that patient. We're giving the patient a specific roadmap of how to acquire and help them acquire proficient movement, which eliminates the functional problem. And because structure and function are interrelated, when you eliminate the functional problem, you then can start to eliminate inflammation in spinal structure. All right, so that hopefully answers that, but feel free to get in touch if that doesn't quite make sense. But it's a pretty simple, sound philosophy, and simplicity is what makes it work too. If you have a complex, there's a principle called Occams Principle. If you have a very complex solution for a problem, it's probably not going to work. Whereas if you get to the root cause of the problem, the solution becomes simpler and simpler and simpler. And the more simple your solution is, the more likelihood that you're going to have a successful outcome. What's your biggest piece of advice for someone experiencing chronic back pain? Get onto it early. Don't ignore the warning signs of pain. They are there for a very important reason. Pain is critical. Take heed of pain. Don't just treat it symptomatically. Address the root cause. The root cause is most likely going to be a functional one, and it's going to be a functional movement deficit, and you need for someone to show you how to move correctly. You don't get that by seeing a physiotherapist. You don't get that by seeing an exercise physiologist. You don't get that by doing core strength. And they're the major mistakes that people make. Even though they may recover from their little temporary pain symptoms, that doesn't mean that you're not going to get more problems in future with another flare-up, what we call relapsing remitting. In fact, 75% of people have a relapsing episode of back pain within 12 months of a primary episode. And that's because they have only managed that condition symptomatically. They haven't managed that condition causatively. And the cause is movement dysfunction. What is one thing you do every single day that contributes towards your health and well-being? Move well, eat well, and define good food by low insulinemia. Okay, you want to have basal insulin in your blood. You don't want insulin to be spiking all the time, because that's going to promote insulin resistance, and then you become even less tolerant to glucose then, which then promotes more insulin resistance, and then you enter this feedback loop cycle where you're getting more and more unhealthy with time, and it's very hard to break that cycle. It is doable, but it takes a lot of discipline and hard work to break the insulin resistance intolerance to glucose cycle. So just don't let that cycle start up in the first place. Try to have a diet that's predominantly low carbohydrate, healthy high natural fats and protein to support your structural needs. Like if you're wanting to be a super high level athlete and have super strong, powerful muscles, you're going to need more protein. If you're happy to just, go to work and mow the lawn and play with the kids, then you don't need a lot of protein. Most of your energy can come from fat. But keep your carbohydrates at the lower end of normal. Certainly well below what nutrition guidelines talk about. I'm referring to maybe 50 grams a day, remembering that a can of Coke is about 40 grams and that 2 slices of toast is about 20 to 30 grams, okay? What's our next big goal? Well, we're just very, very happy and in a really good place with our on a professional level, on a family level, really happy. What we want to do long term is really develop the functional movement training centres, and we think there's the pie of patients that have chronic low back pain today. The number of patients that have that problem is huge. We're talking around 1.5 to 2 million patients in Australia today have chronic low back pain. So they can be helped, but they can't be helped just with one functional movement training centre in Brisbane. We need to make movement therapy the default treatment for acute low back pain. And that's how you're going to stop those patients from becoming chronic low back pain patients. And people will become chronic low back pain patients if they ignore the early warning signs of acute low back pain. And we've got a fantastic team that's ready to do it. It's just about expanding and getting the message out there slowly and with quality. We don't want to compromise quality of movement therapy, because if you compromise quality of movement therapy, you're not eliminating the disease of movement dysfunction. So I might end it there. And Maddy, thank you very much. You, of course, are one of our movement therapists here at the Functional Movement Training Centre, so you of all people will understand what it means to move well and build functional capacity on that foundation of fantastic movement. Okay, so feel free to get in touch, anyone. Nice talking, and all the best, Maddy. Take care. Bye-bye.